News and news with Clarence Ford.
Share your perspective.
Only on Cape Talk.
Welcome back. It is 9:36. This is Views News. My name's Clarence, and that big appointment upon us now. We get to interact with the naked scientist, consultant virologist at Addenbrooke's Hospital in Cambridge, Dr. Chris Smith, joining us. Welcome, Chris. Great to have you with us.
Merry Christmas, everybody. Is this going to be the last time we get together in 2025? Probably is, isn't it?
I think so.
The next time we see each other is going to be a new year.
Probably till the new year. Absolutely.
Indeed. Better make the most of it then, haven't we?
Absolutely. I got to squeeze them all in. Chris, does data carry a weight? Does a smartphone get physically heavier, even by a trillionth of a gram, as you fill its memory with photos and apps?
Yes, the answer to that is no. It doesn't get heavier. It, in fact, gets lighter. Now, the rationale behind this answer is that in a processor or a computer or a USB stick, anything with physical memory in it, the way that information is being stored is in binary data, which is noughts and ones. And the ones are achieved by setting a switch or a transistor to a high state. Now, in order to switch the switch, in order to store data in these combinations of noughts and ones, you've actually got to change the state, but that means electrons are flowing off. And if you're losing electrons, you're losing mass. So when you put data onto a device, it does actually get a bit lighter. And so if you could, with a very accurate balance, weigh your device after you'd added all the data to it, you would find to an enormous number of decimal places accuracy and precision, it would be slightly lighter when replete with data. But there's another question here, which is you're of course going to charge the battery. When you add chemical potential energy to a battery, because when you push electrons into a battery and you increase the chemical potential energy of a battery, which is what a battery is, you are adding electrons, you are adding mass, therefore, and so the phone weight or the device weight, if it's got a battery, is going to increase, and that's going to more than compensate for the tiny loss of mass when you put the data on. Because E, energy, equals mc squared, as Einstein told us. So if you increase the E, energy, to keep the equation balanced in the battery, the M must also go up.
Fascinating. I would like to ask Dr. Chris, what makes people believe in placebos? For example, people who are drunk think eating spicy, hot or salty food takes away the hangover, and they're from Katlego.
There are two effects here, actually. There's not just a placebo effect, which comes from the Latin word placebo, which means I will please. There's the mirror image effect, which is the nocebo effect, which is you can do the same as you do with the placebo effect, but if you tell someone something bad's going to happen, they believe that too. And so if you say, take this pill, it will have all these side effects, you notice, if you follow up with patients, for example, that many more people than chance will report a side effect because of this nocebo effect. And the nocebo effect seems to entrench faster and be more prolonged or persistent than a placebo effect. But they're basically boiling down to the same brain circuitry, which is we have a program in our head of what we expect an outcome to be. When you sort of do something like take a pill and you're told this is what it's going to do, that brain center can invoke other pathways in the brain which include things like your natural pain-killing system, which gates the flow of pain through the nervous system. So part of the pain-killing effect of a painkiller is actually your own expectation that you are going to feel less pain. And scientists about 20 years ago did a really quite neat experiment on this, because they had a setup in their laboratory where they had a needle inserted into the muscle in the face, the big muscle that enables you to clench your jaw. It was all ethically approved, don't worry. And you can inject into that muscle salt solution at a very slow rate, but it produces a certain level of pain. And they were able to dial up or dial down the pain in these people by changing the rate of flow of the salt solution. So you get a constant level of pain. And they were then able to say to people, we're now going to give you a drug which will either turn up or turn down that pain. And at the same time, they could watch in the brain what the brain systems were doing when the people were told, now here comes the painkiller. The painkiller was actually harmless water solution. Wasn't going to do anything, but the people thought it was a painkiller. And when they did that, the level of pain that people reported shot down. The activity and the circuits in the brain, which are concerned with controlling the flow of pain and experience of pain, and they're the same circuits that in fact drugs like morphine and heroin plug into, they all became very active. And we know that the people were really feeling less pain because of this, because the researchers could then turn up the amount of salt solution they were injecting into the muscle to a much higher level to get the same level of pain that the people were experiencing before, showing it really was turning off pain in the nervous system. It wasn't just people saying they felt less pain. They really were feeling less pain. And the same is true with this nocebo effect. People will believe that something bad's going to happen, and therefore if you tell someone something bad's going to happen or it's going to get worse when you do something, they usually do, and it's the same system.
Okay, let's go to a voice note, Joe.
Hi, question for Dr. Chris. Since HPV is immune from sanitizers, sterilizers, spirits, or any other form of protection against it, how would one prevent infecting the other person?
We're talking here about the virus HPV, which is the human papilloma virus. Now, there are many of these. There are 50 plus papillomaviruses, and for the most part, they are trivial and they cause things like warts and verrucas. But a certain number of them are optimized or have a tropism towards the genital tract, and they cause genital warts, and more seriously, they cause cervical cancer and penile cancer. And the way the virus does that is it gets into skin cells, and encoded in the virus is a mechanism to shut off the way that cells normally control how fast they grow. Because a fast-growing cell has got lots of raw materials that a virus that wants to grow can use. So if you shut off a system that normally stops a cell growing, you make cells grow much faster, so they make more raw materials, so you can grow more viruses. That's the rationale behind which these viruses make growths in the skin, like verrucas and warts. But because these viruses sometimes damage the cells in the process of making them grow very fast, they can accrue genetic changes that then lock on that growth system and make the cells continue to grow uncontrollably and in a stressed way, which means they then accumulate and accrue more genetic changes, which then make the cell turn into a cancer. And when we've looked at cervical cancer, almost all cervical cancers are linked to human papillomavirus. It's almost exclusively that it causes cervical cancer. So you can say that cervical cancer is a sexually transmitted disease. And we also find these viruses linked to penile cancer. And more recently, we found the same viruses cropping up in oral cancers, probably because of orogenital contact, because you pick it up in one place, but it can cause the same disease in another place. So what can we do about it? Well, there are a number of things. The most successful intervention in recent years has been the discovery that we can make a vaccine. And used effectively, the human papillomavirus vaccine has almost abolished new cases of cervical cancer in populations where they've had high levels of uptake. And a recent study published in the British Medical Journal looked at cases in Scotland, for example, and found that in high levels of uptake, they got nearly no new cervical cancers in the treated people in the years to follow up, showing this because we know the high-risk forms of the virus, and we know that if you give this vaccine before anyone encounters the virus, you can stop it getting in, and you can clearly stop the cancers forming. Now, that isn't going to work for everybody because not everyone has access to that vaccine. And the other possible intervention is if a man's been circumcised, this dramatically cuts down the rate of HPV carriage because there's less tissue and there are less sites for the virus to lurk. And this means if you can't carry the infection, you're less likely to transmit the infection. And in people who've done studies looking at populations, there is a suggestion that if you look at women who have partners who are circumcised, they may have a much lower rate of cervical cancer than where they've had partners who were uncircumcised. And in one study, they suggested that women whose partners were uncircumcised might have 5 times the rate of cervical cancer compared to women whose partners are circumcised. So the current idea is to try to offer the HPV vaccine to as many people as possible, both boys and girls, because you can protect boys from getting things like penile cancer, much rarer, but you can protect them. But if the boys don't have the infection, the girls can't get the infection. And that also protects people from oral cancers as well. But as a sort of fallback, and because of its also role in protecting people against HIV infection, about 80% of the time, circumcision is also used in a number of places where you can therefore get 2 wins because you stop HIV and you also stop HPV. This has been quite a big initiative across parts of the African continent.
I see a message in the HPV vaccine is horrendously expensive in this country.
Yep.
Right. We are chatting to the Naked Scientist, consultant virologist at Addenbrooke's Hospital in Cambridge. Dr. Chris Smith is with us. So if there's a question that keeps you awake at night, you may want to put it to him. This one is in from Cliff. He represents a minority of views, so you don't really have to be an arbiter in this dispute, Chris. It reads, I maintain there are no 2 oceans along Cape Town's coastline, but snobbish Cape Townians, not contented with already having spectacular mountains, maintain otherwise. That's Cliffing Park.
It sounds like someone with city envy, doesn't it? Cape Town's a beautiful city, isn't it? It's one of the world's best cities for where it is and the way it looks and the lovely coastline. I think Cape Town's gives many of the world's best cities a good run for its money. I think it's someone with city envy.
It's not a question anyway. He says, I maintain there are no 2 oceans around Cape Town. Dear Dr. Chris, is it true that a woman who is allergic to Brazil nuts can get severely ill by having sex with a man who has recently eaten Brazil nuts because the semen can still carry traces of the active substance in Brazil nuts to which she is allergic?
I'm certainly aware of people having allergic and even anaphylactic reactions when kissing people who have recently consumed certain foodstuffs. I'm not aware that the components, usually proteins, in nuts can get through the body and get into seminal fluid, but that's not to say you can just assume not, because you never say never in medicine. I'll take that away and take a look. I haven't heard that reported. I've certainly seen reports of, I was aware of one case of a woman who kissed her boyfriend who had eaten some prawns. She had a seafood allergy and she went into anaphylaxis off the back of that. People who've got any traces of nuts on their lips, if they kiss someone who's got a nut allergy, you can trigger anaphylaxis because you need absolutely tiny amounts to trigger a very profound immune response in a person who's sensitized and at risk of anaphylaxis. So kissing is certainly a risk, but whether you then retain enough of that protein in the body, in body fluids for long enough to cause a problem, I would be a bit sceptical, but I will take that away and see if I can find evidence of that happening, and I can report back the next time we're together.
Thank you, Chris. Now let's go to the WhatsApp line. There's a voice note in from Kevin. Let's take a listen.
Good morning, the good doctor. My name's Kevin. I'm phoning from Brackenfell, or messaging from Brackenfell. I've had shingles and about 3.5 months started. The rash disappeared like it normally does. I'm on Prerica, which is a neuropathic, as you know, medicine. But the pain just doesn't go. It's been 3.5 months. I don't know. Can you suggest anything else that can assist me? Thank you.
Oh, Kevin,
Thanks
I'm
very much.
so
Bye-bye.
sorry to hear this. It's a very common complaint, and it's called post-herpetic neuralgia. And what happens is that shingles, which is a manifestation of the chickenpox virus, which is also called varicella zoster virus, chickenpox lives in your nervous system. It's a so-called alpha herpes virus. You catch chickenpox through the air, goes from your lungs, through your bloodstream, all over your body, grows all over your body, produces the blisters that characterize chickenpox, and in the process infects nerve endings in your skin. The virus goes back up the nerve endings and then hides in the nucleus of the nerve cell alongside your spinal cord for the rest of your life. Like James Bond said, diamonds are forever. We didn't say that, but it's the title of the book, isn't it? Well, herpes is for life. This is a herpes virus. And periodically, the virus reactivates itself. In other words, the genetic programs inside the DNA of the virus turn on and they spawn the creation inside those nerve cells of new virus particles. Those are exported back down the nerve, but not all over the body. This happens in just one patch of the body called a dermatome, which is a patch of skin supplied by one bit of the nervous system. And so you get a strip, usually, or a patch on the skin of extremely painful blisters, which are fully infectious. So if you see those blisters, then you can infect a person who has never had chickenpox with those blisters. So be very careful around pregnant women and also people who have immune problems, because if they haven't had chickenpox, they could catch it from your shingles rash, and that could spell disaster for them, because pregnancy and chickenpox, you can have problems for the baby and you can have problems for mum's health. And with people with poor immune function, people with HIV, organ transplants, other reasons they've got an immune problem, you can get very severe chickenpox infections. So just watch out if that happens. But once the initial rash subsides, which happens usually within a week or so, you stop making new blisters, they all heal up, and the skin goes back to normal. But the problem doesn't stop there, because in a fraction, quite a high fraction of people for whom this happens, you get a persistent pain state like Kevin's describing. And this is a neuropathic pain. There's nothing wrong with the tissue where the rash occurred. The problem seems to stem from the nerve fibres that spawned the new virus. We are not sure exactly why this happens, but there is a suggestion that when the virus reactivates in this way, it damages some of the nerve cells that reactivate. This leads to a rewiring of the back part of the spinal column where those nerve cells normally connect to. And you end up with a position where either the nerve cells are spontaneously active and firing off pain signals, or cells which would normally only receive inputs from pain nerves start to receive inputs from other nerves that signal other sensations. So you end up feeling like you're in pain all the time when there is no pain. Now, this does go away, and some drugs, and these include, as Kevin alluded to, there are some agents like these GABAergic drugs like gabapentin and so on. They can help a bit, but they have side effects. They can be quite sedating. People don't like them because they have other side effects. The antidepressants like amitriptyline can also help with neuropathic pain, but people don't like them. They have serious side effects. So unfortunately, time is the best healer a lot of the time, but it can take a while and it can be extremely distracting and debilitating when it's happening. So what people are now doing is saying, well, it's better to have prevention rather than cure. And we've already talked about the human papillomavirus vaccine on the programme. Well, there is also a very effective shingles vaccine now, also expensive. In fact, there are two shingles vaccines. There's one that's got live virus in it. There's a newer one, which is just based on part of the protein coat of the virus. And when you have those vaccines, which are given to older people generally, because it's as you get older with a poorer immune response that you get more of these reactivation events, so you're more prone to shingles, but they seem to top up your immunity to stop the virus reactivating and reduce the frequency of reactivation. So if you are at risk of this happening, maybe think, next time I'll stop it happening because I'll get a dose of the vaccine. And the spin-off benefit from the vaccine, as we learned earlier this year, is that you have a 20% reduction in your risk of dementia by the look of it. There was a study done on people in Wales when the UK government introduced a vaccine for shingles. They followed up people who either were just a bit too old or just inside the cutoff to get this vaccine, because 80 was the upper limit of the cutoff. And they found that the people who didn't get the vaccine were about 20% more likely to get dementia in the 7 years afterwards than people who got vaccinated. So a very interesting and intriguing story to follow there as well. So you possibly killing two birds with one stone if you get the shingles jab.
Corin weighs in on the topic. I think it's personal experience. She's, in fact, right. It's personal experience. I can tell you that high doses of olive leaf extract will knock shingles out in days if you catch it early. Would you go with the recommendation, Doc?
Well, the problem is once you've already got the rash, a lot of the damage has been done. But, and I probably should have mentioned this earlier, when you first get the tingling sensation, because if you know you're a sitter for getting shingles or you start to see the rash emerging, if you leap on it with the drug acyclovir, which is a very effective, very, very good anti-herpes drug, at high dose, you need a high dose for zoster, which is what shingles is, you can reduce the risk that you'll get severe shingles. And so that might be the other thing to people to consider. It's a bit late for Kevin because he's now got the manifestation. But if you get in while it's evolving, while the rash is appearing, with a high dose of acyclovir, you can nip it in the bud, yeah.
We're going to have to rest it there in appreciation. As always, the Naked Scientist, a very blessed Christmas to you. We'll chat with you again then in 2026. Consultant virologist at Addenbrooke's Hospital, Cambridge. Dr. Chris Smith, I'm going to miss him. I'm sure you're going to miss him too.